He's so cute.
So today I'm going to react to and discuss random videos from TikTok chiropractors.
Listen up, everybody. I have some news.
Hey interns, I'm Dr. Chris Raynor and I'm not your everyday ortho. I teach you about injuries, orthopedic surgery, and medical topics in a way that's easy to understand and entertaining. Today, I decided that I'm going to review some videos from TikTok chiropractors and give you my thoughts on what I see and what I am concerned about. This is a warning. This video will be critical because, to be honest, I'm feeling a bit salty after watching this stuff. Lest some of you get the impression that I hate all chiropractors, let me disabuse you of that notion. In fact, recently I have interviewed several chiropractors, some of whom I like very much, and I am putting together a compilation video of our discussions. So clearly, I'm going to review some chiropractic videos. I expect that the cult of chiropractic will not like that. So here are my ground rules so that you can't say that I am part of the Illuminati. Number one, I'm not going to say that these patients should take drugs instead of seeing a chiropractor. Number two, I'm not going to say that these patients should have surgery instead of seeing a chiropractor. Number three, I do not think that surgery or drugs are the solution for all back or leg pain problems, and I will not suggest that these patients undergo surgery or take drugs to fix their problems. Number four, I'm going to speak about the techniques that I observe and the related medical science. Number five, I don't think that chiropractors are taking patients from orthopedic surgeons because, to be honest, I don't think that we treat the same problems. Number six, I don't hate all chiropractors, so you can take those words right out of my mouth. And to make it interesting, I'm going to respond to each one in 1 minute or less. Let's go.
Good boy, Samuel. Oh, I know. I know. Yes!
Get out of here, man.
Is the microphone on that?
Yeah, sure. Okay, like what the? How is that at all necessary? This is a newborn infant. This baby cannot stand, crawl, or walk. Their spine sees the lowest amount of load or stress possible when it is in a supine or prone position. The load experienced in this position is 3 times less than when side lying and 4 times less than when standing. The muscles of the neck are not even strong enough to hold the head upright consistently. Not to mention, the bones of a newborn are largely cartilage in nature. So expecting them to give you a huge crack is ridiculous, and chasing after the crack in a newborn is dumb.
Did you know that a subluxation, a bone out of alignment right here in the thoracic spine, could lead to acid reflux, heartburn, and indigestion? By correcting that,
Whose man is this?
It's a world of difference. Come on in.
First, the chiropractic concept of subluxations is not real. Even modern chiropractors have discredited this idea. There is no demonstrable link between these supposed subluxations that don't exist and acid reflux, heartburn, and indigestion. There are no studies that show that you can treat any of these problems with a chiropractic adjustment. If you have one, then show that it backs up what you are saying. Otherwise, this just sounds like a Pepto-Bismol commercial.
Took some x-rays and we did an exam, and he's got weakness on one side and a kind of a shake on his left hand side. So we're going to go in there and unload his spine, getting rid of the vertebral subluxations in his neck, and he'll feel that effect all the way down his lumbar spine. So you take a nice deep breath in. Good. Keep your tongue in your mouth, let your air all the way out. Good. Drop this. Don't help me, good. Okay. Good.
We can see he's using the ring dinger table.
Okay, good. Relax your head. Good. Breathe in. And let you get all the way out. Drop this. All right, good. Relax, head down. Good. You felt those release?
Again, with the subluxations. The chiropractic subluxation doesn't exist. It does not refer to the subluxation described in anatomy where the joint is partially dislocated. If this patient truly has objective weakness and neurological findings that are localized like this, then this would be described as a radiculopathy. This might be caused by a disc protrusion or herniation or prolapse on one side of the spine, vertebral facet overgrowth or osteophytes on one side, or spondylolisthesis where the vertebrae are no longer appropriately stacked on one another. Performing a rotatory manipulation on a patient with a potential radiculopathy is just begging to make one of those problems that I mentioned worse. Either the findings that you are describing here are exaggerated for the purpose of the video, or you have big cojones. Either way, it's sus.
There it is.
Good boy. Good boy.
What are they thinking?
Okay.
Dogs either hate it or love it. Sounds like it's 50-50 to me. But seriously, like this dog came to you complaining of back or tail pain, are you for real? Like you could even obtain informed consent. And where is the literature that says that this is valid? It's like stealing candy from a baby. Just because you can do it doesn't make it right.
A little more movement here, you know, a little less resistance from the right trap and tissue.
Ugh. Ay, ay, ay. Yep. Yeah, I hope it doesn't come off in his hands. As we age, it is normal for our joints to show evidence of degeneration. Clinically, this is evidenced by a reduction in the range of motion of these joints. In the neck, this can be demonstrated by a decrease in the cervical range of motion. Radiographically, or with x-rays, this can be demonstrated by a reduction in the joint space between vertebrae, osteophytes or bone overgrowth between vertebrae, or loss of the normal relationship between vertebrae. While I am not a fan of cervical manipulation in general, I am even less of a fan of it in the elderly. In a hospital setting, we exercise extreme caution in this population when handling the neck during other procedures because of the increased risk of adverse events with these patients. Medically speaking, this is not deemed extremely cautious.
There's a hook
Yep, I see it.
to her right. Ready? I see a tooth. That's perfect. Hey, you're not supposed to be looking at me.
Right, they're moving.
Now she's pulling a little to her left. Here we go. Oh,
Jeez.
was excellent. Ready? Ready? Oh, that's perfect. You're not supposed to be looking at me.
To comment on the curvature of the spine in a child that is squirming from side to side while you examine them upside down is what I would call eyeballing it. It is not objective or reproducible, and you are commenting on something that will change randomly from moment to moment as the child moves, and is likely to return to its baseline the moment you stand the child back up and expose them to gravity. Doing a manipulation to correct this nebulous problem that changes randomly with the child's movement is a waste of time. I could punch you in the stomach and change the alignment of your spine, but this wouldn't technically qualify as a mobilization. However, it would demonstrate that you can achieve the same results without cracking someone's back. And for the record, this ain't some manual labor you are adjusting, it's a child. What is it that they are doing that has them so malaligned that they require an adjustment? What? Did this guy just adjust a horse? Come on, this is pure lunacy, man. All right, absolutely ridiculous and for sensational purposes only. Otherwise, every jockey, equestrian, ranch hand, or horse rider in general should get their chiropractic qualification. This is even of less value than it is in humans. If this is a thing, then it shows that chasing the crack is a freaking circus show.
If you look at all these bones, they're individual, and then you get right here, and they ended up fusing together into a block vertebra is what they call it. Bring your left ear to my hand. Oh yeah. So that's going to limit his mobility, create more stress and load on the joints, and that's going to drive inflammation. So we're going to start to put some movement in, and we're specifically going to adjust above and below that area. Oh yeah. Okay. We call this adjustment the money shot adjustment. Okay?
Okay.
Major decompression on your spine.
No doubt. Cha-ching! Money shot. Anyone with a congenital fusion of the cervical spine does in fact have altered forces at either end of the fused vertebrae. It is these altered forces which lead to the rapid progression of osteoarthritis that is associated with fused segments after spinal fusion surgery. Spinal mobility is important in these patients to allow normal function and minimize degeneration that may occur as a result of range of motion restrictions. However, for these very reasons, rotatory manipulations of the spine are worrisome and are not recommended. You can see my thoughts on cervical decompression in my video about the Bing swinger. And I challenge this chiropractor to explain to me the physiologic process behind the resolution of inflammation by you twisting somebody's neck. Go.
Squeeze it.
Jesus, man. Yeah. The two halves of the pelvis are joined in the front at the symphysis pubis. Connective tissue crosses this joint to secure it and allow both halves of the joint to maintain their relationship with one another. The connective tissue can accommodate a very small amount of stretch and movement. For the most part, it is a relatively rigid structure since the pelvis supports the spine above and the legs below. What reason there could be for adjusting the pelvis in this manner? Really, I don't know. Most forces that are going through the pelvis are doing so in a top to bottom fashion and not a side to side fashion. To be honest, a sudden impulse against a contracted muscle is a fantastic way to overload the muscle and its tendon in eccentric fashion. This is the manner in which superior labral injuries of the shoulder or slap tears happen. This technique will put you at risk of an avulsion of the adductor tendons from the pelvis, where the adductor is pulled off the bone where it attaches at the pelvis. Entirely unnecessary. Better and safer results with simple stretching. You certainly won't have to see an orthopedic surgeon afterwards.
Scoliosis. That's been cooking up for lots and lots of years. Beautiful. Last time I looked at that x-ray, I remember seeing 18 fractures out of 24 vertebrae in the spine. Just bada bing, bada boom, bada bing. They were all old fractures. Up, up, and down, up and down, up and down. Good. Ow! Yep. Oh, yes, ma'am. Oh, yeah. Good movement there, huh?
Yeah.
All right, Miss Lorraine, relax that head for me.
Oh, he needs some milk. We got you charged up now.
Good.
Oh, wow. Jesus.
Wow.
Power's on.
All down the back.
Oh,
My middle of my back too.
That all healing takes time.
no doubt, man. Apparently, he witnessed 18 of 24 vertebrae were fractured on a previous x-ray. This is not surprising in an elderly female. These are known as fragility fractures that occur with osteoporosis that result from sex and age-related loss of bone density. These are the types of fractures that occur just from existing, not from any sort of trauma. And these are certainly not the patients that you want to be doing massive reductions or compressive techniques on. Cervical reductions in those with osteoporosis of the spine, whether they are rotatory, decompressive, or extension oriented, is just, shall we say, cavalier. Finally, something I can agree with. Enough said. Those are my thoughts on random TikTok chiropractors. Stay tuned for my compilation on chiropractors coming here soon. Thanks for watching and subscribing. I will see you for rounds next week. And as always, that's been a word from Dr. Chris, not your everyday ortho.
Just a flesh wound.